moments of more intensity and moments of less. But I think everyone was hoping that we would be into a much better place right now. And yet here we find ourselves again in many parts of the country in lockdowns, with public health rules, with school back virtually. And I can tell you as a parent, I'm very aware that the kids are back in school virtually. And I can understand that people are frustrated. But I also know that we know how to get through this. Your orders of government have been working together for months and years now to deliver the things that are necessary on the federal side. We've delivered vaccines, and Canadians have been there to take them up in record levels. We've delivered rapid tests, treatments. We've been there with income supports, and we're going to continue to be there. From the beginning, we said we'd have your backs, and that's exactly what we're going to do. Because this is about keeping you safe, keeping our health workers safe, and getting back as quickly as possible to the things we love. 2 years into this pandemic, however, one thing has changed from those first early months. Canadians themselves, you know what we need to do. You know how to keep your loved ones safe, and more importantly, you know how to keep our health systems from getting overwhelmed. People have been stepping up, there for their neighbors, there to do the right thing, there to get vaccinated, there to support our frontline workers, whether they be in our health system or in our grocery stores or wherever. Canadians have shown their mettle and the way we are there for each other, and we're going to have to keep it up. We're going to have to keep doing that for a while longer. Kids back in school virtually in many parts of the country. Parents figuring out how to balance things. Everywhere, people getting vaccinated. People making sure we're doing the right things. That's going to continue to be the story for the coming months. But we know, because we've seen it before, when waves have hit, like this Omicron wave has hit, we have to hunker down, we have to pull together, and it gets better in a few months. We're looking at a better spring as long as we all keep doing our part. That's why I want to say thank you. Thank you to everyone who's been doing their part, everyone who's been stepping up, and everyone who will continue to step up. There's no magic bullet on this. None of us want to be here right now. But we know what to do to get through it, and I know Canadians will continue to do it. Even though we're tired, even though we're frustrated, we can get through this together. On vaccines and boosters, we now have enough vaccines in the country for everyone. I got my booster yesterday. It's about all of us doing our part to make sure that through this Omicron wave, we do not overwhelm our healthcare system. Think of the healthcare workers who've been there for months and months and months, stepping up in extraordinarily difficult situations. People have been there for them. Puis c'est jamais trop tard.
And it is never too late to get vaccinated.
Si vous êtes là pour votre booster, merci.
If it's your turn to get your booster, thank you for getting it. If you're getting your children vaccinated, that's the right thing to do. And if you're arriving at the moment where you are choosing to get your first vaccine, thank you. It's never too late to do the right thing. I can assure you that the healthcare workers who will be there to give you your first shot will be very pleased to provide you with that vaccine, even in the coming weeks ahead. We know what we need to do to get through this.
We need to do our part. And if you haven't yet gotten vaccinated for whatever reasons, know that there is a vaccine for you waiting. at your local pharmacy, at your local health center, we have all the vaccines we need for all Canadians. So please, get yourself vaccinated. That's how we keep our health systems from getting overwhelmed. That's how we minimize the impact of COVID on our society, on our economy, on our neighbors, and on our frontline workers. We're also continuing to send tests, rapid tests, to provinces and territories. We delivered a record number of tests in December. We're going to quadruple that in January. On parle de 120 millions.
We're talking about 120 million rapid tests already delivered, and we will continue to deliver. We're also there as a federal government to help provinces and territories that are experiencing the most difficulty. We are in the process of deploying 200 members of the Canadian Armed Forces into Quebec vaccination clinics. And we will continue to be there with tests, with vaccinations, and the necessary treatments. At the same time, as the federal government has been since the beginning, we will continue to support workers and businesses. We will maintain measures in place to help you if you need them. In particular, I would like to highlight the wage subsidy. This subsidy is there to maintain a tether between you and your job so that you may continue to pay for your bills, to put groceries in your fridge. And you will also know that your connection to your job is maintained. This measure is used by companies that are hard hit. There's also the rent subsidy. And we are here for you alongside the provinces to help you. We are there to help provinces make the right decisions. If public health officials say that it is necessary to introduce public health measures, we're there to support them. We're there to support Canadians, and that is how we will get through the pandemic. But it is also how we will get through the economic crisis, by minimizing the long-term impacts on our economy.
Workers, small businesses, we will always have your back. We have income supports, and we have a wage subsidy that is continuing for hard-hit businesses to allow you to keep your link to your job and put food on the table in situations of lockdown or public health restrictions. We know that's the best way of getting through the health challenge, but it's also the best way of getting through the economic challenge, so we can bounce back stronger once we get through this particular wave. So thank you to everyone doing their part. We're going to hang in there. We're going to keep getting through this, and there will be better days ahead.
Much work is ahead of us to rebuild a stronger Canada.
Historic agreements for compensation and reform for First Nations, child and family services, and Jordan's Principle. For far too long, Indigenous kids at risk were being removed from their communities, putting in situations where they lose their language, they lose their culture, they face mistreatment. We need to recognize our responsibility collectively for that, but we also have to put an end to it going forward. And that's what this historic agreement was all about. And I want to thank all the partners who've been at the table throughout these many last weeks, working extremely hard, putting kids at the center of everything we do, making sure we're compensating kids for harms in the past, making sure we're putting an end to it into the future. From the various communities and Indigenous leaders, thank you. To Senator Murray Sinclair, who's been an extraordinary advocate for children throughout, to everyone involved, the ministers who worked hard on it, thank you. But there's still a lot of work to come. We've signed these agreements. Now we have to make the changes. We have to get the compensation out, but we also have to make sure we're transforming child and family services for First Nations kids across this country so that we break the cycle that continues to harm children in this country. This is also a difficult time of year as we remember the victims of Flight PS 752 and other air disasters, families who continue to grieve, who celebrated yet another holiday season with empty spaces around the table. Know that we stand with you. Know that we continue to fight for you. Know that we will continue to be there to support you as you grieve, as you face the long, slow process of healing, and as we continue to demand accountability and justice.
I'm now very pleased to hand the floor over to our Health Minister, Jean-Yves Duclos. Thank you, Prime Minister, and good day, everyone. First, I would like to take this opportunity to wish a very happy New Year to everyone tuning in today. Unfortunately, with the Omicron variant spreading fast across the country, this is not the New Year we were all hoping for. But despite it all, there are many reasons for us to be hopeful and optimistic about the future.
In the past 2 years, and I know that Canadians are feeling the effects of the stress and uncertainty this pandemic has brought into our lives. But let's be clear, January 2022 is not March 2020. We have made significant progress, and we are continuing to add resources and tools to help protect and support Canadians. Because of our early planning and successful work to procure vaccines, we are now able to weather the Omicron variant in a much stronger position. Last year, we rolled out the largest vaccination program in our country's history. Almost 80% of all Canadians of all ages were fully vaccinated in 2021. Booster shots are rolling out across the country, with more than 7 million boosters administered across the country to date. Finally, we're also protecting our children. More than 40% of kids aged 5 to 11 have already received 1 dose of vaccine. This month alone, we expect to have enough supply in our country for all eligible children to receive both doses. We would be in a very different position right now if we did not have such a high vaccination rate and the vaccine supply we need to support further vaccination efforts throughout the new year.
Our collective job now is simple. It is to vaccinate unvaccinated populations, to continue to deliver booster shots and continue vaccinating our kids. On that particular front, as the Prime Minister said earlier, our government announced on Monday that it approved the Quebec government's request for assistance. As of yesterday, the Canadian Armed Forces have deployed 200 general duty personnel to aid in the logistics related to vaccination. My colleague, Minister Blair, and our teams will be monitoring the situation and will adapt our support to the Quebec government as the situation evolves.
Over the past few weeks, all levels of government have had to make tough choices to protect public health and to protect our healthcare system. The Canadian government has an important role to play in that regard. Last month, we implemented new measures at the border to slow the arrival of the Omicron variant, including advising Canadians to avoid non-essential travel. Our government is also temporarily expanding the eligibility of several support programs to help those impacted by new public health restrictions driven by the Omicron surge.
Rapid tests are also proving an extremely important tool in helping Canadians reduce the spread of COVID-19. Before December 2021, our government delivered 85 million of these tests to provinces and territories. In December 2021 only, an additional 35 million tests were delivered to our provincial and territorial colleagues. Today, I am pleased to confirm that an additional 140 million rapid tests will be delivered to provinces and territories in the month of January. As requested by our provincial and territorial colleagues, these tests will be allocated to the provinces and territories on a per capita basis. This is 140 million tests, which is many times the number of tests delivered in December. Rapid tests are an important tool.
The spread of Omicron. Before December 2021, our government had delivered 85 million of such tests to provinces and territories. In December 2021 only, an additional 35 million tests were delivered to provinces and territories. Today, I'm pleased to confirm that an additional 140 million rapid tests will be delivered to provinces and territories in the month of January. As requested by our colleagues from provinces and territories, these tests will be allocated to them on a per capita basis. These 150 million new rapid tests for January represent 3 times the December delivery of 35 million tests. Deliveries are already well underway, and we will keep you posted as often as possible. Across Canada, all levels of government are doing their best to help slow the spread of this virus and support Canadians. These are challenging times, but they will not last forever. We have the tools we need to get through this new wave of the pandemic. Let's continue to exercise caution. Continuons de protéger notre santé.
Let's continue protecting our health and the health of others by following public health advice. Let's continue to take care of one another and to have hope, because that is important for us to get through the challenges of the new year. And I would also tell you that there is no country better prepared than Canada to get through this new wave of the pandemic together. Thank you. And now it is my pleasure to turn to the Deputy Minister and Minister of Finance, Chrystia Freeland.
Merci beaucoup, Jean-Yves.
Thank you very much, Jean-Yves, and good day, everyone.
Good morning, everyone. Our government understands that to win the fight against COVID, we need to have the right tools. We need vaccines, we need rapid tests, we need therapeutics, and we need to have the measures in place to support people and businesses economically to get through restrictions and lockdowns. We have these tools. Our government spent the fall putting these tools in place, making these investments to prepare for this difficult winter. In December, before the holidays, we released an economic and fiscal update that included significant investments, including the purchase of 180 million rapid tests and a $2 billion investment in therapeutics. These were to support our collective effort to finish the fight against COVID and to handle the Omicron surge. Et avant cela, en octobre,
And before that, in October, we announced the launch of the Targeted Aid Program for Canadians and Canadian businesses, including a provision for a renewal of the wage subsidy and the rent assistance in the case of a lockdown. These programs came into effect in December when Bill C-2 entered into effect. Because of new restrictions put in place to fight Omicron across the country, we also decided to temporarily expand the definition of lockdown to help more Canadians and to make sure no business or employee is left behind. We are there to help provinces and territories take the very difficult decisions needed to respect public health advice. The federal government will be there to support SMEs, workers, and our communities. And from the beginning, our support has been unshakable. The federal government has provided 8 out of every $10 spent in Canada to fight the pandemic and to support Canadians.
In recent weeks, as we all know all too well, most parts of the country have announced new lockdowns or other public health restrictions. Many of these restrictions have an impact on people's jobs and their businesses. I'd like today to reassure Canadians by reminding them that the federal government has made sure that economic support is available to you if you need it. Last week, applications opened for the Canada Worker Lockdown Benefit. So if you are a worker in a part of the country that is locked down or subject to 50% capacity restrictions, and if you have lost 50% or more of your income as a direct result of those restrictions, you can be eligible to receive $300 a week. And you can now apply online directly through the Canada Revenue Agency. We also know that businesses, especially small businesses, need support. That's why we have in place the local lockdown program, which will provide wage and rent subsidy support of up to 75% to employers who've had to reduce the capacity of their main business by 50% or more. And let me remind businesses that we have temporarily lowered the revenue decline threshold from 40% to 25%. There is also further rent support of an additional 25% that's available for businesses subject to a full lockdown. From the start of this global pandemic, we've understood that having a job is central to the well-being of Canadians. These wage and rent support measures are about protecting people's jobs and allowing people to stay connected to their employers. That keeps people strong, it keeps families strong, and it keeps businesses strong. And that's what we need to keep our economy strong. Expanded eligibility for both the wage support and the rent support runs from December 19th through to February 12th.
The support is also eligible to businesses that are going through other losses related to the pandemic through the Tourism and Hospitality Recovery Program and the Hardest Hit Business Recovery Program. Also, as a reminder, this support is paid for by taxpayers and is meant for businesses to support their workers to get through the pandemic. Every public program, or business rather, that chooses to increase remuneration to its CEOs in comparison to 2019 will no longer be eligible for this support. Also, all businesses that pay dividends while collecting this benefit will become ineligible. Our government takes managing public funds very seriously. We require businesses who benefit from these programs to be respectful of the eligibility criteria.
The best way to end this pandemic and the best economic policy is strong public health policy. As the Prime Minister and Jean-Yves have just reminded us, the best thing all of us can do is to get vaccinated and to get our boosters. I also want to say to all Canadians that in these really difficult times, as a country, we have shown true grit and true resilience. Last week, The Economist ranked Canada's economic performance during the pandemic as second in the G7. We have more than recovered all of the jobs lost in the depths of the pandemic, well ahead of expectations. And Canada has the second lowest mortality rate from COVID in the G7. By supporting each other, by working together, we have kept our economy strong and we have saved lives. I know that this is a frightening time. It's a frustrating time. It's a truly difficult time. So I would like to reassure Canadians, we have the tools to get through this. We know how to work together as a country, and we are resilient. We have shown that to ourselves, to each other, and to the world over the past year. For nearly 2 years now, we have been fighting in an unprecedented time. We have been facing an unprecedented challenge together. I know none of us wanted to be facing this Omicron surge, but we have the tools to get through it. And I have every confidence in us that we'll get through it together. Merci.
Thank you. I think I will now be handing the floor over to our colleagues, the journalists, to ask us questions.
Hi, everyone. So I'm told that the Prime Minister is with us for 20 minutes. We'll start with reporters in the room. We've worked out how it's going to go. I'll start my stopwatch in 1 second. And reporters, you will need to follow up on each other. There will be no follow-ups. Starting with Tom Perry of the CBC, please.
Hi, Prime Minister, Minister Duclos. I'm just wondering on this. First of all, Minister Duclos, you said 140 million tests, and then 150 million. Which is it? Do you anticipate you're going to be buying tests at this pace moving forward? And we've seen people in places like Ontario and Quebec scrambling for tests. And I'm wondering, is this going to ease that, or does it still come down to distribution by the provinces?
It's 140 million in January. I didn't make one mistake, which an economist has no excuse for making, is I said that 140 is 3 times 35. 140 is 4 times 35. And 140 million is also, on average, 1 rapid test per week per person in Canada in January.
Yeah, I think we all understand that rapid testing is going to be part of the path through it. We've seen over the past year certain jurisdictions like Nova Scotia make extensive use of rapid testing. The federal government has continued to procure rapid testings over the past year to distribute to provinces. Provinces made determinations around how to distribute them. Obviously, it's another tool in the toolbox. Certainly with the speed at which Omicron is propagating through our communities and through our country, it makes sense to have rapid testing. There are reflections of how to integrate rapid testing results into our overall understanding of the way the cases are evolving across this country. But as you point out, Tom, the distribution of those rapid tests is primarily done by the provinces. Our job is to procure as many as we possibly can and get them to the provinces free of charge. They will make determinations around delivering them to people. We have certain stockpiles for vulnerable populations and specific usage, but the vast majority of rapid tests will be sent to provinces and territories for them to distribute in the best way to serve their citizens.
Prime Minister?
We know that rapid tests are part of the solution. They're one of the tools that we have to fight this Omicron wave. There are some provinces who have been using the rapid tests for over a year now. in a very helpful way. I think of Nova Scotia, for example. As a federal government, we must ensure that enough rapid tests are being sent to the provinces and territories. That is our responsibility. As the Minister of Health said, we are in the process of procuring hundreds of millions of tests, but it will be up to the provinces and territories to design the best way to distribute them to citizens.
Bonjour, Christian Noël de Radio-Canada.
Good day, Christian Noël from Radio-Canada. Good day and Happy New Year to both of you. I would like the answers in English and in French, please. We have provinces who are limiting access to PCR tests, so some people are catching the virus and not being tested. There are people taking tests at home who may test positive and not disclose their result. What do you have to say about a possible invisible wave of COVID? Minister Duclos, I will respond briefly. And I will also ask Dr. Tam to provide more scientific specifics. There are other tools that the provinces and territories can use to compensate for the missing data.
Des équipements, mais surtout du personnel pour administrer les tests PCR à travers le pays. Donc, c'est un enjeu important. On sait que les provinces
There is an important issue. There's a lack of public health staff and equipment to ensure everyone is tested. And we know that the procedures around these tests are one of the major issues the provinces and territories are facing. Booster shot administration also needs to be accelerated because we know boosters are necessary to bring back up protection levels to a satisfactory level. And we're seeing a crisis in certain regions of Canada when it comes to the healthcare system being able to have the capacity to treat the people who are catching COVID. And now I will hand it over to Dr. Tam.
Thank you for the question. I would say that in Canada, we will not miss an entry of this variant or its spread in the community. There's enough testing to detect that. Even in the more remote areas, there's the use of point-of-care molecular testing on top of rapid tests. They don't necessarily send their tests to a laboratory. There are already systems in place. We are doing more daily tests than any other period during this pandemic. And I think just in the week preceding January the 1st, there were over 1 million laboratory tests being done. So if you're tracking the trajectory of this virus, we will be able to look at the trends. The provinces are not testing every case, but there's so many tests being done that I think we will not miss waves going through a community. And the clinical presentation and other factors will tell local medical officers whether they have the virus or not. And on top of that, we're doing other testing, such as in wastewater as well.
Évidemment, on a beaucoup de différents outils qu'on est en train
Of course, we have numerous different tools that we are using. We will use all of these various tools to ensure we have the most accurate idea possible of the Omicron wave across the country. And just because we're using varied tools, it doesn't mean that there is an invisible wave. What is important is that we ensure we are there for people who need help, that we're there for health workers, and that we ensure that our healthcare systems do not become overwhelmed. And it is with these resources that we will maximize our efforts.
Abigail Beeman, Global News. Hi, Prime Minister. I heard you reference kids going back to school virtually and acknowledge frustration that people are feeling. I'm wondering what you say to parents who are frustrated that they were repeatedly told closing schools would only be a last resort and who feel that your government hasn't invested enough in healthcare capacity, which could have potentially averted these kinds of closures.
We have, since the beginning of this pandemic, invested around $63 billion in healthcare supports on top of the usual healthcare transfers that we send to the provinces. So we have been there, and we will continue to be there to make the investments from the federal level to help people get through this. But I can understand the frustration that parents are feeling. You went through the same puzzlement over the weekend about when our kids were starting, who were starting virtually. Turns out they're all virtual. All these challenges that parents are trying to adjust to and adapt to at the same time as we're dealing with public health restrictions is not easy. My role as Prime Minister and as the federal government is to be there to provide the vaccines, the rapid tests, secure the borders, be there on treatments, be there with income supports for businesses, for workers, and to do everything we can to make sure that the provinces have the tools to make the right decisions for them, for their citizens. And we will continue to be there every step of the way to support orders of government and indeed all Canadians in the way we move forward.
Glenn McGregor, CTV News. Prime Minister, there's still a significant population in Canada that's refusing to get vaccinated despite all the things you've done, travel restrictions, vaccine mandates, you coming out here at press conferences imploring them to get their shots. In France, they're bringing in new measures with what President Macron calls his intent to piss them off. Wondering what you were going to do that you haven't tried already to reach these people who are continuing to clog up the ICUs.
Well, I think, first of all, we do have to recognize that the vast majority of Canadians have stepped up, have been there to get themselves vaccinated, to protect their loved ones, to protect frontline health workers. And that is significant. We're amongst the top countries in the world in terms of citizens stepping forward to do the right thing. So it's not just about governments and health workers frustrated that there are Canadians who still continue to choose to not get vaccinated. It's fellow Canadians as well. When people are seeing cancer treatments and elective surgeries put off because beds are filled with people who chose not to get vaccinated, they're frustrated. When people see that we're in lockdowns or serious public health restrictions right now because the risk posed to all of us by unvaccinated people, people get angry. And we have put forward many, many different measures to encourage, to reassure, to incentivize, to educate, to cajole, to remind people that it's never too late to do the right thing. It's never too late to go and get your first dose of vaccine. I can tell you that that frontline health worker who's giving you your first dose of the vaccine, even now in January 2022, will be immensely pleased to be able to give you that first dose of vaccine even today, because they'd much rather be giving you an injection of vaccine than intubating you in an ICU. We need to continue to do the right thing the way all Canadians, or the vast majority of Canadians are, keep each other safe, and make sure our country gets back to the things we love as quickly as possible.
Hi, Prime Minister. Stephanie Taylor with the Canadian Press. During the campaign, you extolled Sunwing as a leader in the pandemic. It's benefited from government subsidies, as have other airlines. But in light of the video that surfaced that showed the company allowed one of its planes to be chartered for a party where there was no holds bar and no COVID rules were followed, is your government going to be asking for taxpayer money back from Sunwing? And what's going to happen to those passengers when they return to Canada?
I can assure you that Transport Canada is taking this situation extremely seriously. There will be a full investigation into exactly what went on in this situation. I think, like all Canadians who've seen those videos, I'm extremely frustrated. We know how hard people have worked to keep themselves safe, to limit their family gatherings at Christmas time, to wear masks, to get vaccinated, to do all the right things. And it's a slap in the face to see people putting themselves, putting their fellow citizens, putting airline workers at risk by being completely irresponsible. I can assure you that this is a situation that Transport Canada takes extremely seriously, and we are definitely following up on that. Je peux vous assurer
I can assure you
Transport Canada
that Transport Canada is taking the situation with that Sunwing flight very seriously. It is unacceptable for people to be putting at risk not only other citizens and not only airline workers, but themselves as well. When here at home, people are making sacrifices, people have been reducing their contacts during the holidays. They didn't see their loved ones. And the vast majority of Canadians understand that it is necessary to make sacrifices to protect one another. And then we have these irresponsible travelers who decided to go away on vacation. And when we see this, it is extremely frustrating and demoralizing. And I can tell you that Transport Canada and the Government of Canada are taking this very seriously and will be making follow-ups on what transpired.
Fraser Needham, APTN National News. Being that the problem seems to be not the amount of vaccines or the number of rapid tests that the federal government has made available, but maybe the province's ability to distribute them efficiently and people not being able to get access, and also that it's the federal government, not the provinces, that are responsible for First Nations people's health. What, if any, special measures is the government taking to ensure that First Nations communities, especially in remote areas, can get access to these tests and also the vaccines?
From the beginning of this pandemic, as a federal government, we have paid particular attention to the vulnerabilities faced by Indigenous people and Indigenous communities across this country. We've seen from pandemics past, including H1N1, just how vulnerable Indigenous communities can be to pandemics. And that's why from March 2020 onwards, we have leaned in specifically and directly on ensuring supports for Indigenous peoples and Indigenous communities across this country. That goes from early vaccinations through Moderna to remote communities in the north back in the beginning of 2021, to specific measures around testing and rapid tests, to extra supports for frontline workers. We will continue to be there with a very, very careful eye to make sure that there are adequate supplies to Indigenous communities, recognizing the vulnerabilities that come from more fragile and less robust infrastructure around health, around so many other things. But I'll turn to Minister Duclos if he wants to add anything.
Well, I can, but the Prime Minister summarized that really well, and it's obviously in collaboration, in my case, with Minister Aidu and Minister Miller, who are working with public safety to make sure that, as the Prime Minister just said, the Indigenous peoples in Canada, for all sorts of reasons that you mentioned quickly, now are appropriately supported, given the circumstances in which they often find themselves. So we were, as the Prime Minister said, quite successful in the first waves of the crisis in making sure that they would be vaccinated and provided with all sorts of other supports, and we'll continue to do that.
I think we have time for 2 solo questions on the phone. Operator, first reporter, please.
Thank you, merci. La première question de Mylène Crête.
First question from Mylène Crête from La Presse. Line open. Good day. Regarding rapid tests, I would like to know, given the large quantity that will be made available in January, do you think that some provinces that are not yet doing so should allow the tests to be freely sold in pharmacies? Answer. Yes, the delivery quantities are considerable. 140 million rapid tests will be delivered in January, which is 4 times the 35 million delivered in December. And this is also higher than the amounts requested by provinces prior to December. Secondly, these tests are provided to the provinces and territories freely at no cost by the federal government. And we have full confidence that the provinces and territories will use those tests in the most equitable and effective way. In the most effective way, because these tests will continue to be rare. Around the world, the demand for these tests is very high and competitive, and Canada is doing good work to secure deliveries in Canada. We know that in most provinces and territories for the past few weeks, tests have been being delivered quickly and also based on who needs them most.
And the last reporter, preferably for the Prime Minister before he goes, please.
Thank you, merci. The next question is from Ryan Tumilty from the National Post. Please go ahead.
Yeah, sir, I wanted to ask, you're announcing today this 140 million rapid tests going to the provinces. Are you concerned about how the provinces are using them? Because it has been sort of scattershot across the country. Different provinces have used them in a variety of different ways. You know, in Ontario, we've seen them handed out at liquor stores and given to students, and other provinces have used them in different ways. Are you concerned that they maybe aren't being used in the best way possible to prevent wider spread of the virus?
Thank you for your question, Ryan. And it's one that there have been many iterations of over the past couple of years. When we talk about how one province or another is responding to one aspect or another of the pandemic, we have to recognize that the different regions in this country are facing very different situations. And we are a federation in which the delivery of health care is a responsibility of the provinces, and they will make determinations around how to best serve their citizens in the right way, given the expertise that they have, given the recommendations of their local public health officers. Our responsibility as a federal government is to make sure that there are enough rapid tests, enough vaccines, enough treatments, enough income supports, enough border controls, all the things the federal government has done and will continue to do, we are doing. The provinces will make determinations, and hopefully they will learn from each other and share best practices in terms of what is working well in one place or another. But we expect the provinces and territories to be there to distribute these rapid tests that we are procuring by the hundreds of millions to citizens to help us get through this wave of Omicron as best as we possibly can.
I want to thank the Prime Minister of Canada for joining us today. We're going to continue after he leaves with the ministers and the doctors for 5 minutes. That's 15 minutes. Prime Minister, thank you very much.
Thank you, Chris.
Good to see you. Folks, equity, I'm just going to stay on the phones, just restarting my watch as the PM leaves. Okay, restarting my watch for 5 minutes, staying on the phones. Operator, first reporter, please.
La prochaine question est de Boris Proulx.
Next question from Boris Proulx from Le Devoir.
Bonjour, j'aimerais
Good day. I'd like to know what you think about announcements from provincial governments, including the Quebec government, reducing the lockdown or quarantine time to 5 days. From your point of view, is this appropriate or is it dangerous? Minister Duclos, I will quickly answer and give the floor to Drs. Tam and New. On rapid testing, there's something I would like to clarify. Of the 140 million rapid tests that will be delivered in January, 31.5 million of those will be delivered to Quebec because it is based on a per capita numbers. Quebec has also requested higher numbers of rapid test deliveries recently. And as for the question, I will invite Drs. Tam and New to reply.
Okay, bonjour.
Dr. New, good day. I can begin to respond to the question, and Dr. Tam can always chime in. We are always in conversation with our counterparts in the provinces and territories because we know what the current situation is. That is, the Omicron variant is everywhere in the country. We're seeing cases everywhere. And public health's goal is always the same, to reduce disruptions in our society, reduce serious cases, and to reduce disruptions for our health workers. We are also in touch with the CDC in the United States, and we also take into account accommodations for public society. So the situation continues to evolve. We continue to base ourselves on the data. And yes, it is a challenge to strike a balance between what we know about the contagiousness of the virus and the functioning of society. And that is the same current issue being faced by provinces and territories. The authorities in the provinces and territories know their own context best, and it is up to them to strike a balance. As for us, we remain in constant communication with our provincial and territorial counterparts. And I would say to you that it is often a question of risk management and deciding one's tolerance to risks. For example, do we want to lock down confirmed cases for 10 days? Yes, that is always ideal, but it is not always possible given the current situation. So what about 5 days? Yes, 5 days of lockdown usually is possible for most contaminated individuals, but even with the 5 days of quarantine, contagiousness is possible after that. So we will continue to discuss this matter and try to strike the best balance. Thank you. My follow-up question will be for Minister Duclos. Do we have details on rapid tests? Will they be delivered in boxes of 20? And do you know what the delivery calendar for January will be for deliveries to the provinces? And do you accept any responsibility in the shortage of rapid tests in communities and in pharmacies? Answer. Thank you very much for the 3 separate questions. The first question was about the delivery boxes. There is quite a variety of types of rapid tests that have been requested and that are therefore being delivered to the provinces and territories. I do not have the details with me, but traditionally, each province or territory selects a variety of different boxes. And the provinces and territories' requests must be treated equitably. The deliveries will not change. They have worked the same way for the last year. As for the different types, I do not have those details. I would have to consult my officials. There is a very large quantity of tests being delivered, several million for Quebec only, just this week. And for supply chains, we prefer to confirm a delivery once we have been able to confirm that the delivery is completed on the ground. And as for the final question, as I've said and as others have said, over the past weeks, provinces and territories before December 2021 were facing quite a plethora of challenges.
Que les provinces et territoires devaient privilégier. Ça a changé beaucoup à partir du début du mois de décembre. On est passé d'une moyenne de 7 millions de tests par mois qui étaient demandés à 35 millions livrés en décembre.
At first, they were asking for an average of 7 million tests, which has substantially increased. So the requests for rapid tests from provinces and territories has quickly increased. And this is true for all provinces and territories. And I would say that good faith and great cooperation is true for all provinces and territories.
Try to keep the responses as tight as they can just because of the time. One more on the phone, operator. A single question.
The next question is from Stephanie Levitz from the Toronto Star. Please go ahead.
Good afternoon. Thanks for taking our questions. My question is for Minister Freeland, and it relates to benefits, sort of a pickup on a thread I asked you when we saw you the last time. There's lots of businesses now in the country that are facing pretty significant labor shortages due to COVID isolation requirements. So they're not being forced into lockdown. They're not being told to reduce capacity. The issue is that their staff are off work, having to isolate because they have COVID, a child has COVID. For these businesses in particular, are they eligible for any of your existing support programs, or are you considering any new or changes to these support programs to address this reality that some businesses are just forced to close, again, not because they're ordered shut by public health, but because they simply don't have enough staff to run their operations?
Thank you for the question, Stephanie. The specific so there are three levels of support for businesses that are available right now. And I do want to emphasize to businesses that are listening, these measures are available. The wage and rent subsidies will be paid retroactively for each period as they have been previously. So this is support that's there, the portals are there, and you can count on it. There are three levels of support. The first is the lockdown support. So if you are fully closed down or subject to that restriction of 50% or more, you qualify for the wage and rent subsidy. And there is that rent subsidy 25% top up if you are fully locked down. So that's one form of support. There's the support for tourism and hospitality as per C2. And then there is the hardest hit business support. And the tourism and hospitality and hardest hit business support does not require that you are subject to restrictions or lockdowns. But for that specific category of businesses, Stephanie, that you mentioned, who are not subject to any particular lockdown or restriction measures, nor are they in tourism and hospitality, the way they could qualify is if they find themselves in a hardest hit business category. So if they have a revenue fall for whatever reason, and a shortage of workers could be that reason, they could be covered by that provision.
Great. Glenn McGregor, please. Staying in the room till the end.
Glenn McGregor, CTV News. Question for the doctors. The Food and Drug Administration has approved booster shots for those ages 12 to 17. Just wondering where we are on that in Canada, when we might expect boosters to be authorized for that age cohort.
It's Teresa Tam. I don't know if the minister wanted to take that question, or would you like me to go ahead?
Well, Dr. Tam is obviously signaling that this is belonging to the regulatory branch of Health Canada, which is outside of PHAC, and the regulatory branch is obviously an independent branch of the political office of mine. But we'll come back to you with a more precise answer.
I would just add that we will be, of course, having ongoing discussions with the National Advisory Committee on Immunization. The way I understand it, there is actually no specific data being submitted by the manufacturer, which is how the regulatory authorization usually works. So it may be a bit different between Canada and the United States as well. And for sure, we can get back to you from a Health Canada perspective. But right now, of course, the key is to get the initial doses into the arms of the younger children, as well as getting the boosters, particularly for the higher risk.
Stephanie Taylor, CP.
Question for Dr. Tam. I want to know what she thinks about Ontario and other provinces moving to 5 days isolation instead of 10, and the direction like Ontario has, for example, where there's not a lot of information provided to close contacts. Is this a smart move when you're infected with COVID-19? Is this not a smart move? I'd like your reaction.
Yes, I think Dr. New had also provided an answer to that question as well. And we're discussing all of this with other chief medical officers of health and sharing information across the country. Of course, we're still learning about the Omicron virus, and that things like the incubation period or the period during which people can be infectious. So all of that is a sort of scientific foundation. And there's still a number of uncertainties. And there's, of course, the most precautionary approach, which is taking longer isolation and quarantine periods, but recognizing that there's realities of keeping society going, particularly the health system, as well as other critical infrastructures. And those are the difficult decisions that provinces have to make. And so right now, because of the sheer volume of cases, provinces are no longer doing individual case and contact management. That is just not possible for the public health system. And they're focusing on the high risk settings where they will pay much more diligent attention to chasing up contacts, etc. So that's just the reality. And therefore, there's general messaging to the population in terms of what you should observe if you're a case or if you're a contact. And so I think 5 days of isolation, is that long enough? Well, if you wanted to be very precautionary, and some provinces are at the moment, you may take a longer isolation period. But this is a balancing of the risks versus the need to protect your critical infrastructure. And of course, for any members of the public, you have to wear your mask, well fitted, and observe all the other measures really diligently, even if you're coming out of isolation and the quarantine period.
Tom Perry?
Hi, Dr. Tam. It's Tom Perry from CBC. I was just wondering if you have any concerns about the ability of rapid tests to detect the Omicron variant. What do we know about that at this point?
I think there's still data coming in, but some of the rapid tests will detect the Omicron variant. The difficulty with this particular virus is just how quickly people may develop the infection post-exposure, and things can shift really fast. So one just has to remember that if you tested negative in the morning, that doesn't mean that you may not test negative, later on. And if you, depending on what setting you're going into, you're going to have to do very frequent rapid tests, depending on your particular individual situation. So that's a challenge really with Omicron.
And Abigail Beeman has our last question.
Hi, I'm wondering if you can update on any conversations around changing the definition of fully vaccinated to include a booster. I know this question gets asked from time to time. Is there anything new to share?
Yeah, it's not at this point. I think from a federal perspective, as we look at the international border, for example, we know that most countries in the world haven't had the benefit, some of them not even a initial course of vaccine, and that a booster is not accessible to most. And I think that we will be revisiting this question again after our booster programs have rolled out significantly in the domestic context. And we do know that there's evolving international knowledge about the effectiveness of the vaccine. And the most important thing about the vaccines that we have are that 2 doses offer substantial protection against severe outcomes, and a booster dose can increase that protection as well. But this vaccine, the vaccines we have globally are just not as good as reducing infection rates with the Omicron virus, even though it can be boosted somewhat with a booster dose. And so at the moment, the definition of what fully vaccinated means from an administrative perspective hasn't changed.
I'd like to thank the Deputy Prime Minister, Minister Duclos, Dr. Tam, Dr. New. Thank you very much for today. That's all from the Parliamentary Precinct in downtown Ottawa.
And that was the first COVID update of this new year, the third calendar year of this pandemic. And we heard it from the Prime Minister himself. This is not how people wanted to begin 2022. But Justin Trudeau also says Canadians know what needs to be done to meet this challenge. And while not announcing any new measures or programs, he did reiterate there are supports for businesses and individuals at this point of the pandemic.